Namaskar, Sat Sri Akal, Salam Alaikum, greetings from the AFPI International Relations and Collaboration Committee. My name is Dr. Kamlesh Bhargava and I'll be the host with you today. And today we have Dr. Nidhi Lal, who's an associate professor in Boston University. She's the co-chair of the International Relations and Collaboration Committee too. And today we'll be talking about her visit, her exchange between US and India, and specifically the Department of Family Medicine in Rajkot, All India Institute of Medical Sciences. So without further ado, over to you, Dr. Nidhi. Can you tell us more about how this came about and what you exactly did?
Yes. Thank you, Dr. Bhargav. Welcome to everyone. So this has been a relationship that we have been developing between Boston University and AIIMS collaboration over various sites. I did attend and present on the importance of family medicine in India and primary care in India at the AIIMS Rishikesh location in 2025. And this has resulted from a meeting with Dr. Bhaumik Modi, who is part of the Department of Family Medicine and Community Medicine at AIIMS Rajkot. And he decided to invite me to talk to family medicine residents who are now undergoing their training. And it then grew from a talk to family medicine residents to a talk to the entire hospital staff or medical staff regarding building medical trust in patients and doctors, between patients and doctors, and the role of the Sutradhar, as I like to say it, or the family doctor in the midst of all.
Let me interrupt you. When you said medical trust, I just want to clarify, it is not a financial trust. It is a medical trust, right?
Yes. It is the communication or the doctor-patient relationship that really is the foundation for good medical care.
Okay, thank you. So this was your collaboration with the Department of Family Medicine, but the whole, it was open to the rest of the departments also. And you basically had a workshop or a lecture or plus interactions. What kind of sessions did you have?
So I had a small workshop within the Department of Family Medicine and Community Medicine. So we had all the residents, the community medicine residents, the family medicine residents who came and attended that workshop. And this was on communication and different styles of communication. How do you talk to patients with language barriers, with other disabilities, and health literacy? And then we had a overarching talk with the medical staff where they have I forget if it was weekly or monthly medical staff, I think it's monthly, medical staff meeting where residents present cases, and then they gave me a good amount of that meeting time where I was able to talk to the entire medical staff over all of the departments.
So you spent a couple of days there in Rajkot?
Yes. I spent 2 days there.
Right. So now would like to know what are the key differences between practice and this medical trust in North America as compared to India?
That's a great question. Actually, communication is key everywhere. No matter if it is, so Rajkot is Saurashtra, Gujarat, and there are very essential nuances in patients' habits, language, cultural beliefs there, versus in Boston, I see a variety of patients from all over the world. There are a large number of my patient population is immigrants or asylees, and they bring their cultural beliefs from all over the world. And it's having an open mind, having the time and the patience, and certain listening skills like eye contact or just, not writing or typing on the computer. These are the little nuances that we tend to forget in our busy day-to-day life. We also don't get trained on it as in medical education, but it is starting now, and we have realized that it is very, very important because if the patient doesn't tell you, you don't know.
Yeah. So that's interesting. So, any comments on what are the major challenges which you face in communication or developing this medical trust in North America as compared to India?
So, one of the things always I have seen, be it across the world, there is some hierarchy. Patients always feel that the doctor is at a pedestal, and we need to equalize the field. I think it is more so I found it a little bit more so in other parts of the world other than North America. It is on us, the doctor, to bring it down and tell the patient we are at the same level and we are really interested in knowing what you have to say, because without knowing everything, we can't treat you. Also, there is a lot more embarrassment about certain cultural beliefs in other parts of the world. I won't just say India, because I have seen it in patients from other countries also. So it's not unique to India. Language, maybe in India, because we have so many dialects. Even though everyone speaks Gujarati, there are so many other regional dialects, and the word can be very nuanced and very different. So if you don't know and don't have the time or patience to understand it, you won't get it.
Mm-hmm. Interesting. So when we talk about this medical trust, and the point which was coming to my mind was the doctors in India, especially in the generation which I was trained, patients took them in the parental role or the pedestal role, etc. And often they would say, "Oh, you decide for me." And then you are talking about something what we call it here is at the shared care, at the same level, and we how acceptable, what percentage of the population is, and especially even in this day and age, at time with so much of information available on AI, everybody earlier used to Google things. Today they might do their research on AI.
That's very true. And everyone in India has a smartphone, or almost everyone in India has a smartphone. So they have access, definitely there. But, there is a role for paternalism in medicine, and there is a role for shared decision making. And it's up to us to offer it to the patient, and then they can decide which way they want to go. Um, I'll give you a small example. So, in India, we talk a lot about malnutrition, especially in the rural populations, and there is a big problem of malnutrition. However, I was very pleasantly, so, we tell patients that you drink milk and you add this to your diet and you add that to your diet. And it has become so easy to get processed foods that instead of malnutrition, obesity is becoming a problem. Just because you're overweight does not mean you're not malnutritious, nourished. You may still have vitamin deficiencies and other concerns. So I was pleasantly surprised and to be informed that in Saurashtra, which is a lot more rural and children are very much brought up based on their traditional practices, malnutrition is, even in the poorest families, is quite low as compared to the rest of Gujarat state.
Oh.
Because of their cultural practices, because of their traditional thing of sports and the diet they feed the kids.
Mm-hmm.
So, we can't go with an overarching belief. We need to find out exactly.
So, okay. So coming to another aspect is how did you benefit from this collaboration?
Oh, I learned so much. I have to say, it's always a two-way process. Just like the doctor learns from the patient and the patient gets relief from the doctor. Um, I think going out opens up our minds, learning these nuances in medical care in different populations. I learned a lot about sickle cell disease, sickle cell carriers, the stigma related to sickling in Gujarat, which is not something that I was very familiar with. I grew up in different parts of the country, not necessarily Gujarat, so I wasn't very familiar with that. It also was very, very refreshing to see how eager family medicine is very new in India, how committed the staff is, and how eager the students were in learning, and making sure that they practice broad spectrum primary care.
Okay, that's good, because now I get the impression that you understood their challenges, their concerns, and their enthusiasm to learn more. It was not that, oh, yeah, you have the ideal world in North America. This is one of the messages which we convey when we go there. Nothing is ideal. So that's good.
Correct.
Coming to, say, the last part is this sort of international collaboration relations can be done at what levels? At individual levels, institutional levels, organizational levels, etc. And how does it benefit? Especially, let us focus on the individual doctors.
I think it definitely benefits. It requires support, motivation, and encouragement. For the individual doctors, for the trainees, it gives them opportunities to look into more research, more scholarship, more opportunities for presenting, and gives them the support that, because family medicine is so emerging in India, they have the broader world community behind them. That is one. We as teachers learn different variety of students, and how do we communicate, and how do we spread our teaching skills. So there is a huge learning benefit for both sides. I think that we do need to pay a little bit more attention on developing scholarship, so that the students of primary care or family medicine understand how important it is to keep doing their research, keep strengthening their skills, their clinical skills, as well as their scholarly skills.
Okay, thank you very much, and I think we have come to to a conclusion. Now, for the general audience, what I can say is the Academy of Family Physicians of India International Relations Collaboration Committee is committed to developing these kinds of exchange programs, supporting them, whether it's based on individuals or organizations at different levels. And this is one example where the doctors coming from outside, they learn, as well as those who are hosting them both learn. So we are encouraging at all levels, say from one city to another within India, to international collaborations too. And whether you are going for travel, tourism, etc., for any reason, you can always reach out to a doctor or family physician to have a cup of tea, to just visit their facilities, etc. For that, you don't need any licenses, permissions, etc. That we can facilitate that. You won't get chances to see patients, but that would be an excellent opportunity. So with that, any last final words, Dr. Nidhi?
Thank you to AFPI and IRCC for these collaborations, these opportunities, and I think that we need to definitely work on establishing a network where both we have the opportunity to go and visit these various sites, as well as they have the opportunity to learn from us, so that we can strengthen relationships.
Thank you very much. Thank you.